Alright, so in this video, I'm going to talk to you guys about patient prep. So this is basically shaving, scrubbing, anything like that, and I am going to demonstrate scrubbing for you guys in a target pattern as well. So first we're going to start with the Spay landmarks. It is the xiphoid process, which is the bottom of the rib cage, and it goes all the way down to the pubic bone. And so we want to make sure the whole area is clear of fur, debris, hair, anything like that. I mean, they're going into surgery after all. So we're going to stretch the skin to make sure we get a really, really nice close shave. And you want to go against the grain of the hair or fur so you can get a very, very close cut with a number 40 blade. On spay or on neuters, we're going to push back the testicles, and you want to shave from about 1 inch from the prepuce all the way down to about 2/3 of the scrotum, and make sure you do about 3 clipper blades wide. So you can do 1 down the middle, 1 on each side type thing, and then we're gonna push the testicles back upwards and do the bottom third. So all of that is fully clipped. And then if we do have a male cat, make sure you pluck the fur around as well, because their testicles all are small, and small testicles, big clipper blade doesn't sound like fun. So for the Spay surgery scrub, we have 2 different choices. You can do chlorhexidine or you can do iodine, and most places that I know of do use chlorhexidine. It is much more, well, there's a lot of advantages to it. One of them is it isn't as likely to cause chemical reactions or burns with any other item that you're using. So if you're using alcohol especially, it could have a chemical reaction on the skin with that. So chlorhexidine is much safer in that sense. It is also much safer and nicer in the form that it has a longer residual time and less contact time. So compared to iodine, it doesn't need nearly as long contact time, and it will have a longer lasting effect. And so that's just like a couple more things on how it's above iodine, I guess. And so comparatively, iodine has longer contact time, shorter residual time, and it could potentially cause chemical reactions. And that is just why we use chlorhexidine. And then alcohol versus sterile water to clean off the chlorhexidine or the iodine. Here at Globe, we do use alcohol. It sanitizes better than sterile water, and so because of that sanitizing factor is why we use it. So now I'm going to show you how we scrub. We do use a target pattern, and you want to make sure you do this so you don't recontaminate anything. And there's one specific little trick as to how you don't recontaminate. So I have a boat here with 2 gauze in it. I'm just going to use one, and they're just watered down. So when you have your gauze, you're going to fold it over like a triangle, fold it again, and fold it again. And you're just going to use the tips. You want to make sure you don't exactly touch that so you don't have cross-contamination. So we start by going back and forth in the middle, and then you spin. So you want that arrow tip constantly facing out. You want it facing towards the edge of your patient where the fur is. And then once you get close to the edge, you want to make sure you're not drawing it back in, and that's it. And you would do this a total of 6 times technically, 3 of your scrub and 3 of the alcohol or sterile water, whatever your clinic uses. And that's how we do it here at Globe.